Good evening, everyone. Welcome to Ways and Means at Dusk. So with that, I believe we are ready to have the staff call the roll.
Assemblywoman Benitez Thompson. Here. Assemblyman Frierson. Here. Assemblywoman Gorlow.
Here.
Assemblyman Hafen.
Here.
Assemblywoman Howdigi. Assemblyman Levitt.
Here.
Assemblywoman Miller.
Here.
Assemblywoman Monroe Moreno.
Here.
Assemblywoman Peters.
Here.
Assemblyman Roberts.
Here.
Assemblywoman Titus.
Here.
Assemblywoman Tolles.
Here.
Assemblyman Watts.
Here.
And Chair Carlson.
And I am here, and please mark Assemblywoman Howdigi absent, excused. So we have a number of bills before us this evening. Committee will start off. We have 2 BDR introductions so that we can get them to the floor tomorrow and get them right back to us. Then we have some agency bills and some personal bills. My intent is to move the bills in the 400 series to keep them moving so that everything is staged appropriately. So unless there's an issue as we work through these, it would be the chair's intent to get these things taken care of. Ways and Means will meet as long as Senate Finance this evening. There's other work to be done when both committees are free. So if Finance ends before us, any bills that are left over will be rolled until our next meeting. But if they go longer than us, then we can get our work done. So that's sort of the game plan for this evening. So with that, I will turn it over to Ms. Kaufman for the BDR introductions.
Thank you, Madam Chair. BDR 1-1076, relating to crime defense, revising various provisions relating to the appointment of attorneys, removing limitations on fees earned by certain attorneys, revising provisions relating to claims for compensation and expenses made by certain attorneys, creating special account for support of indigent defense services, revising certain deadlines for requirements placed on board of county commissioners relating to transfer of responsibilities for the provisions of indigent defense services to the state public defender, and provides other matters properly related thereto. Do you want me to do the other one?
Let's do both of them at the same time and take one motion. Thank you very much, Ms. Kaufman.
Sure. The next BDR is BDR 16-1143. This act relates to crime, requiring the Division of Child and Family Services of the Department of Health and Human Services, to the extent money is available for this purpose, to designate a statewide center to provide assistance to certain victims, authorizing the administrator of the division to accept any gifts, grants, donations, bequests, or other sources of money for the purposes of carrying out the duties related to the center and providing matters properly relating thereto.
Thank you very much. Committee members, are there any questions or comments on the 2 bill introductions Ms. Kaufman mentioned? If not, I'll take a motion from Vice Chair Monroe Moreno, second from Ms. Benitez Thompson. Any other questions or comments? Seeing none, all those in favor, please signify by saying aye. Aye. Any in opposition? Hearing no opposition, passes unanimously. We'll send them to the floor so they can send them right back to us. So with that, let's go ahead and get our agenda rolling for this evening. The first bill that we're going to be talking about will be Assembly Bill 461, makes an appropriation to the Office of Attorney General for the cost of replacing standard glass windows and doors with ballistic glass and frames at the Carson City office. So, Ms. Adair, nice to see you this evening. I'm sorry we have to talk about a bill like this, but I guess that day has come. So if you would please go ahead and just give us a high-level overview of the bill, and then we'll ask some questions.
Thank you, Chair. Jessica Adair for the record. My feelings exactly. I'm also joined today by our CFO, Jessica Hoban. This is a very limited replacement of this glass. It is just for the 2 windows for the Attorney General's personal office here in the Carson City office, as well as the window that faces Carson Street with the Attorney General's executive conference room. We received a quote and have been working with Buildings and Grounds for an appropriate vendor to make that replacement. And I am happy to answer any further questions about that quote or the location of where we're proposing to replace the glass.
And thank you very much. And I guess my question would be is how did you decide which windows to be placed? Because we know a lot of people work on the first floor and we want to make sure everyone is safe. So what were the discussion points? And did you consider more or less? How did you settle upon this particular amount of renovation?
Thank you, Chair. Jessica Adair for the record. We made this decision based upon some specific threats to the Attorney General himself, unfortunately, rather than the office as a whole. I agree with you that ideally we would likely replace all of the glass, but that seemed to be cost prohibitive particularly for this building. It's a historic building, and so they have to replace the glass in a specific way. However, there aren't many staff whose office windows are on the ground floor that face Carson Street. It's mainly the AG's office and that executive conference room. So that was another factor in our decision.
And thank you for putting that on the record. We just want to make sure that we understand it fully. A number of years ago, there was a proposal to build in all types of interior barriers and such. And I remember seeing the diagrams, and when you walked into the Attorney General's office, it was going to look like you were going through the airport. And we just said, no, we don't think that's the perception that we want. So I'm glad you're considering the outside glass and trying to maintain the historic components. I'm going to channel Assemblywoman Heidi Swank for just a moment. I think she would approve of ballistic glass. She would understand replacing those windows. So with that, committee members, are there any questions for Ms. Adair in the Attorney General's office? Ms. Miller.
Thank you, Chair. And Ms. Adair, that was my line of questioning too, considering that it is a historic building and we want to keep the, that historic look to it, but also with structurally, and you already mentioned that, getting estimates based on, because the actual renovations will be different based on, the age of the building and such. Is this total right here the final estimate? Because again, any type of renovations, especially trying to keep something structurally sound like this, is there a possibility that it would increase and be more expensive than anticipated? And if so, what would that process look like at that point?
Thank you, Assemblywoman Jessica Adair, for the record. We worked with an approved vendor as well as Buildings and Grounds to ensure that the vendor was an appropriate vendor who understood how to replace glass in a historic building and ensure that there was going to be no damage to the building or any change in the appearance of the building, that it would just look like a different, the glass would just be replaced. I don't believe that we will go over that estimated cost because that is the quote that we received. I suppose anything is possible when working with the vendor, and if they see that their initial quote wasn't accurate. However, we don't anticipate that happening because that number is from the vendor itself.
Are there any other questions from any committee members at this time? Dr. Titus.
Thank you, Madam Chair. And thank you for the presentation, not having been in the committee that heard this initially. I was just curious if there's any other buildings in the state or any other offices that are looking at in the future to have this type of renovation?
Jessica Adair for the record. Not that I know of. The AG's office, and I can only speak to the AG's office. The AG has 3 offices in our 3 main buildings, Reno, Las Vegas, and Carson City. In Las Vegas, his office is located in a place that we believe is more secure or less of an obvious threat. I hate to talk about this. It makes me so sad. but his office is not located immediately off of a busy street. And in the Reno office, we actually lease from a private office building that there is no window access that we have to be concerned about. I can't speak to the other agencies or what they might be interested in doing based upon their security, but I don't believe that we have any other intention to make any changes to our office based upon the information that we have at this time.
Great, thank you. And follow up, Madam Chair, I guess I didn't realize that, I now realize that this wasn't in another committee, so it hasn't, those kind of questions hadn't been asked, so thank you for that indulgence. I just was wondering if there's any other departments, if this is a perceived threat or an actual threat, because again, it is a crazy world we live in. I, like the chair, am sorry that we have to have a discussion to protect our folks, and if we have to have it, we have to have it. But there's other departments that have certainly been under a lot of stress this last election cycle, wanting to make sure that we're keeping all Nevadans, all of our elected safe. And so just want to know if there was any other future plans to expand this.
Jessica Adair, for the record, that is a great question. We unfortunately have been in receipt of information due to our position that would indicate that AG Ford is not the only recipient of these kinds of threats. But I can't speak to the plans of other state agencies to fortify, for lack of a better word, their buildings.
Well, thank you, because we certainly did it here. So again, I want to make sure that it's across the board and all state employees all Nevadans should feel safe. So thank you. Thank you, Madam Chair.
Committee members, are there any other questions at this time? Not seeing any other questions, this is the hearing for Assembly Bill 461, so we'll go ahead and open it up for support, opposition, and neutral. So broadcast services, if you would check the phone lines, please, to see if there is anyone in support of Assembly Bill 461.
If you would like to testify in support on AB 461, please press star 9 now to take your place in the queue. Chair, there is no one on the line to testify in support of AB 461.
Thank you. If you could go to opposition, please.
If you would like to testify in opposition to AB 461, please press star 9 now to take your place in the queue. Chair, there is no one to testify in opposition to AB 461.
Thank you very much. If we would go to neutral.
If you would like to testify in neutral on AB 461, please press star 9 now to take your place in the queue. Chair, there is no one to testify in neutral on AB 461.
Thank you very much. So with that, we'll close the hearing on Assembly Bill 461, and we will open up the hearing on Assembly Bill 462, making an appropriation to the Department of Corrections for an upgrade to and reintegration of certain management systems, replacement cameras, storage area networks, and ovens. This is the one I've been waiting for. I want to hear about this oven. But we have had conversations previously about replacement cameras and the network. So with that, if I could go ahead and have a representative of the department give us a brief overview of what we're looking at here, and then we'll open it up for questions.
Good evening, Madam Chair. This is Lisa Lucas, IT Chief for the record. So the reintegration into Notice and the replacement is kind of a two-part. Can you hear me?
Yes, we can. Thank you.
So Notice is our vendor management system that we've had since we implemented in 2007. And at the time we had that, we had purchased and implemented the module to do our vendor sentence management. Legislation came down that we had to do aggregation. So we, in-house, we pulled that out of Notice and we built an application in-house. Well, as time has gone on, we no longer have, that position is vacant, so we no longer have an employee in-house to work on the back end of that in the code. So if this were to fail, it's mission critical. We'd be out of compliance with the laws for the state of Nevada. We have the ability to put it back into notice, and they have the ability to do real-time calculations. So we'd have real-time reports for the various offices that also use this, and we do reporting to. And then the other part of this is the whole notice system. We would be upgrading that to their next generation version. Right now, it's a standalone application that uses Internet Explorer, which is reaching its end of life for support. It would be web-based, it'd be current, and we wouldn't have to rely on a lot of these things that are going to end of life that would eventually cost us more money to be able to maintain.
And are you finished? I just want to make sure something didn't freeze.
Yes, yes.
Okay, good. Tell me about the oven. We have been
Good evening, Madam Chair.
very curious. We don't see this often, so, we're easily thrilled.
I'm glad I can entertain you. Good evening, Madam Chair and honorable members of the committee. For the record, my name is Adrienne Monroe. I'm the acting chief of fiscal for the department. The combi ovens are a very versatile but very expensive oven. It's called a combi because it's really a combination oven. It can do cooking with steam or dry air like a convection oven, or a combination of both. High Desert State Prison has had 5 combi ovens that were original to the institution back in the year 2000. And the expected asset life cycle of this piece of equipment is 15 to 20 years if you take good care of it. So we've definitely reached our end of life on that. We had a health inspection in October of 2019. At that time, 3 of the 5 ovens were not operational. Since that time, another oven went down, so we used extraordinary maintenance funds to get a new combi oven this fiscal year, and the only other operating one is an old one that is not operating well, takes a lot of effort. They are so old that we can no longer get parts for them, so we really need to make sure that we have a sufficient number of ovens to feed the 3,500 inmates daily. And this funding request of $102,747 will afford us the purchase of 3 base model combi ovens with the minimal packages that are required for prison packages that have safe door locks and some other things on them. And that's about all I can tell you, but I'm happy to answer any questions.
Thank you very much. We appreciate it. My curiosity has been dealt with. So with that, committee members, do we have any questions for the department at this time? I believe the Assemblywoman Tolles.
Thank you, Madam Chair. And I was just wondering if you had any more of those oven mitts.
We're not going down the oven mitt road. I was waiting for somebody to do that. And it's not an oven mitt, it's a pot holder. Okay, so with that, not seeing any other serious questions, thank you for dealing with the committee this evening. It's been a crazy week, and it's only Tuesday. So seeing no other questions, this is the hearing on Assembly Bill 462. Let's bring it back in. So with that, we'll go to broadcast services. If you could please open up the phone lines for anyone who may be in support of Assembly Bill 462.
To testify in support on AB 462, please press star 9 now to take your place in the queue. Chair, there is no one to testify in support on AB 462.
Opposition, please.
If you would like to testify in opposition on AB 462, please press star 9 now to take your place in the queue. Chair, there is no one to testify in opposition to AB 462.
And in neutral, please.
If you would like to testify in neutral on AB 462, please press star 9 now to take your place in the queue. Chair, there is no one to testify in opposition to AB 462.
Thank you very much, Broadcast Services. We will go ahead and close the hearing on Assembly Bill 462, and we will open up the hearing on Assembly Bill 463. Makes a supplemental appropriation to the State Department of Conservation and Natural Resources for an unanticipated shortfall in the forest fire suppression budget account. We've seen this one a number of times before. So with that, if I could have the agency, hello, Miss Casey. Casey, how are you this evening?
Fine, thank you. And you?
Doing well. If you would like to go ahead and give us a brief overview, introduce yourself, give us a brief overview of AB 463, and then we'll go to questions. Thank you.
Great, thank you. Good evening, Madam Chair, members of the committee. For the record, Casey, State Forester Fire Warden for the Nevada Division of Forestry. Assembly Bill 463 is a supplemental appropriation request for the division that covers projected shortfalls in the forest fire suppression budget account in the amount of $2,359,168. This supplemental appropriation will be used to fund current and past year wildland fire suppression expenses that have already been incurred. The division's incident billing staff have worked hard over the last 3 years to expedite and make more accurate the wildland fire billing system and process on behalf of the division and the counties or fire protection districts participating in the wildland fire protection program. The NDF incident billing unit is caught up to FY21 fire bills, excluding cost share and fire management assistance grants fires, which take much longer to finalize. The billing process will be further expedited and made more accurate with the new automated fire billing system approved in the last legislative session. NDF has received the new fire billing system and is currently training our federal and local government partners on inputting their data into the system so they can begin use. All users will begin using this automated billing system on July 1st of this year. Thank you for your consideration of Assembly Bill 463, and I would be happy to answer any questions you may have.
And thank you very much, Ms. Casey. So we have one number in the bill, and then we have an amendment proposed. Would you please repeat the number to make sure that I have the most accurate data?
Thank you again for the record, Casey. The number is $2,359,168.
Okay, I've confirmed that in my amendment. I just always like to do that when we have a change, just to make sure we're good. So with that, committee members, are there any questions of our State Forester Fire Warden? Dr. Titus.
Thank you, Madam Chair, and thank you, Director, for being here. I just wonder, I saw the exhibits with this bill, and that's from the city of Laughlin supports it, but I'm wondering, and then you mentioned the new billing system, which I greatly appreciate because I've been critical of the past of you submitting requests for additional funds from bills that you received that happened years ago. So hopefully it's current, but I don't see anything about this particular $2 million. What was the expense on this particular $2 million?
Thank you, Dr. Titus, for the question. For the record, again, Casey, the expenditures for this $2,359,168 are for past expenses for past and current year fires. So those are all of the cooperators or agency staff that showed up to fight the fires, the contractors, everything that we are required to pay for past fire years. So there should have been a backup in the spreadsheet that showed all of the expenses that are incurred to date. And we did try to just put into the supplemental the things that we know we need to pay currently, not projecting a whole lot of future needs, as we know we're going to start a new budget in July 1st.
Great, thank you, Madam Chair, for the question.
Thank you, Dr. Titus. So, Ms. Casey, one of the things that has been pointed out to me is that the $5 million that was allocated to the agency through the interim finance committee over the summer, the conversations that we had around that, apparently there was no reversion date of unspent funds put in there, so if there would happen to be some odd amount, it would just sit there and not have any direction on what to go. So we're contemplating having establishment of a reversion date out like maybe June 30th of 2025. Give you plenty of time to use it. We just want to make sure that money doesn't sit in account and never really gets cleared out as things change. So that will be one of the consideration points that we address when we process the bill. So just wanted to give you a heads up. Did you have any thoughts on that?
Thank you, Madam Chair, for the question. Again, for the record, Casey. No, I talked to LCB fiscal staff today, and I was aware of that change, and we very much actually appreciate that change. We wanted to move that's a lot of money for us. It's tied to a large grant we have with, or program we have with NV Energy, so it's matching those funds. And we have allocated a good portion of those to local government fire districts in order to get a lot of work done. So we appreciate the extension in order to get that work complete.
Okay, thank you very much. Committee members, are there any other questions of Ms. Casey? Not seeing any. This is the hearing for Assembly Bill 463. We'll go ahead and go to broadcast services and open it up. If we could have folks in support, please.
If you would like to testify in support on AB 463, please press star 9 now to take your place in the queue. Chair, there is no one to testify in support on AB 463.
If we could go to opposition, please.
If you would like to testify in opposition on AB 463, please press star 9 now to take your place in the queue. Chair, there is no one to testify in opposition to AB 463.
Thank you very much. Anyone in neutral?
If you would like to testify neutral on AB 463, please press star 9 now to take your place in the queue. Chair, there is no one to testify in neutral on AB 463.
Okay, thank you very much. So committee members, at the end of the meeting, we will come back and deal with these 3 bills. So keep them in your memory for right now. With that, we will go ahead and go to the top of the order. We have Ms. Gorlow with 2 bills. We're just going to have her do them both at one time. So we first up will be Assembly Bill 189, and then we will go to Assembly Bill 216. So Ms. Gorlow, when you are ready, we will allow you to do opening comments on 189.
Thank you very much, Madam Chair. For the record, my name is Michelle Gorlow, and I represent Assembly District 35. I'm here to present AB 189, which was also amended to include interim HHS Bill AB 193. AB 189 aims to reduce pregnancy and birth complications, and there are 4 parts to this bill. First is presumptive eligibility, then expanding Medicaid eligibility from 165% to 200% of the poverty level, eliminating the 5-year residency requirement for legal residents, and providing postpartum care from 60 days to 1 year. So presumptive eligibility is a process in which a pregnant woman who would normally qualify for Medicaid is able to receive prenatal care while her Medicaid application is being processed. And this will allow more women to access early prenatal care. It is estimated that 396 women in 2022 and 2,504 women in 2023 would benefit from this program. Expansion of eligibility for pregnant women to 200% of the federal poverty level will provide insurance to more women. And the estimate of pregnant women between ages 12 and 44 is 3,640 in fiscal year 2022 and 3,749 in fiscal year 2023. Eliminating the 5-year residency requirement for legal residents would also provide health coverage to more women. It is estimated that this program would serve approximately 52 women in fiscal year 2022 and 97 in fiscal year 2023. Lastly, providing postpartum care from 60 days to 1 year. Giving birth can be difficult on a woman's body, especially if there are already complications such as gestational diabetes, preeclampsia, or a cesarean section, which accounts for over 30% of the deliveries in Nevada. In addition, women can suffer from postpartum depression and, in severe cases, psychosis. The American College of Obstetrics and Gynecology, also known as ACOG, now refers to postpartum care as the 4th trimester and recommends that care should be a continuous process as a way of setting the stage for long-term health and wellness for both mom and baby. The fiscal note provided by the Department of HHS Health Care Financing and Policy has been calculated to state general funds at $1,063,447 for presumptive eligibility, expansion of Medicaid eligibility to 200 at $10,191,825. However, if we add the addition to the postpartum coverage, that would add an additional $3,773,512. Coverage for legal residing pregnant women would be $75,169. And again, the additional impact for the postpartum care coverage would be an additional $112,209. And then the 12-month postpartum coverage would be $8,133,480. Let me try that again. $8,133,487 for a grand total of state funds of $42,786,648 for the biennium. I also have Mr. Dwayne Young here and can answer any questions you may have.
And thank you very much, Ms. Gorlow. In the document that I have of the summary, I have some different numbers, so please be sure that the document that you're reading from, you make available to the committee members so that we have that. And then I'm going to go to Mr. Young to possibly help us walk through some of these numbers to make sure that what I have on my chart and what you have and what they have all comes together. So with that, committee members, are there any questions of Ms. Gorlow at this time on the multiple components that are in 189, the first reprint? Not seeing any questions. So with that, I'm going to go to Mr. Young. And Mr. Young, if you could help us go through, we see the original fiscal note, but we realized it was amended. So you guys got out the calculator and you did a number on this one, didn't you? Just want to make sure that we actually understand how you came to arrive at some of these numbers. So if you would walk through this for us, I would appreciate it. Thank you.
Certainly, and with me tonight is Dr. Ellen Crecilius, actuarial economist for the division. And so depending how deeply we would go, I may turn over some to her, as well as Ms. Lisa Sweargen, who is the Chief of Eligibility and Payments, to address the DWIS portion, which is the eligibility portion, just on presumptive eligibility for the Department of Health and Human Services. And for the record, I am Dwayne Young, Deputy Administrator of Programs for the Division of Healthcare Financing and Policy. We can actually walk through, and the document that Assemblywoman Gorlow was actually walking through is something that we provided to her to just help prepare for this presentation tonight. So we can go to a couple different pieces. Obviously, I think probably one of the easiest to understand is the coverage for lawfully residing pregnant women. And so these are women who are lawfully residing in the United States, but have not yet met their 5-year requirement for residency. During the 2017 session, if you remember, there was a bill that expanded this for children. It is allowable to also receive match to expand this for the mothers, and we did not do that at that time in 2017. And so this is that component. It would estimate really, as Assemblywoman Gorlow pointed out, and so the total computable on that is about $108,000. The state general fund portion would be $37,000. She did provide an additional.
And Mr. Young, if I could stop
figure.
you, Mr. Young, if I could stop you for just a moment. If you're referring to any particular budget category, either 3178, 3158, where you actually are, so that I can help track where these numbers actually belong? If it's actually in one of the, is it in one of the fiscal notes? Because I know they amended one bill into the other. So are we talking, what category are we in, so I know which sheet of paper I'm looking at? That would be very helpful to me.
I'm sorry. We are in medical.
Okay. So medical costs
3243.
3243?
Yes, 32,
Okay.
budget account 3243.
Thank you.
And these are purely demonstrated for medical cost within 3243 for this fiscal note. The additional figure that Assemblywoman Gorlow quoted is the addition that if the committee, and what we did is we tried to break this out into piecemeal because it's a myriad of options. But if the committee did pass the additional portion that says for 12 months postpartum coverage, that state general fund obligation in 3243 would jump from 37,000 to 55,000. And that would also increase the total computable amount from 108,000 to 161,000. There is no county obligation for this A category. And so these are all only state and federal funds that we're discussing.
Thank you, and if you
I will
go ahead
pause
and
there
move
to
on
see
to the
if
next
you have-
item.
Okay. The next, and I will be the presumptive eligibility portion. This category is all in 3243 because it speaks to our portion, and I'll turn it over to Ms. Swearengin to walk through the DeWitt note. Our portion speaks to the expanded categories of coverage, and so the expanded months of coverage. As we know, many of these women would be newly eligibles or parent and child category and fall within managed care, particularly because they live in the urban areas, some within fee-for-service. And so there's a calculation of the additional fee-for-service expenditures as well as the managed care capitation months, and that is in 3243. And that is a total computable of 454,000 with a state fund obligation of 155,000. Again, there are no county match funds on this, so we're speaking solely to state or federal. This calculation is not impacted by the additional postpartum months. And so this figure is solely dealing with that extra months of eligibility in those pre-trimesters of catching those individuals early.
So, Mr. Young, I'm going to stop you right here because I'm trying to find the numbers that you're talking about, and they're not tracking them with the fiscal note that we have. So, was another document submitted that we don't have right now, or are we just working from your testimony?
I believe we submitted an updated fiscal note. I just checked Nellis to see what you're seeing. And I do not see the both amended bills appearing into 189 with capturing all of these fiscal notes. I do see only the presumptive eligibility piece that we've just discussed now that's posted, that these numbers should track to the same.
Okay, on the presumptive eligibility, I believe we're good, but I believe it's the amended version that we don't have the information that you are citing.
Okay, that is all information that is contained within the fiscal note of 193.
And I don't think we have the fiscal note for 193. So I have a document that refers to 193, but I don't believe a fiscal note for we actually have a fiscal note for 193. But now that we know where to look, we can figure it out. Just wanted to make sure that we're working off of the same song sheet. So give us just a second. Okay, if you would go ahead, I tell you what we're going to do is, because we've started, I don't want to just stop and not go forward. If you would go ahead and just walk us through a couple more of the components, And then I'm going to ask you to put all this together in a little more comprehensive package for us and send it to Ms. Gorlow and myself so we can go over it and make sure that we're all on the same page. And then I'll forward it on to fiscal staff. They've got a lot of other things they're trying to deal with right now. So we'll take this over, but when we're done here, I'd like you to put together a document that gives us a real picture of this to make it a little bit easier rather than a fiscal note for 189 and a fiscal note for 193 that we have to merge together. We're going to ask you to do that for us and get it to us, and then we'll be able to move forward. But please go ahead and proceed with your testimony so that we create the record. Thank you.
Most certainly, please accept my apologies, Chair, that we will find out what the disconnection from getting over from the Governor's Finance Office to you all, the combined note. We will provide that to you as well as the document that we provided Assemblywoman Gorlow to prepare her for the presentation this evening. The last two components of this is the expansion to 200% of the federal poverty level. As mentioned earlier, 32 states, including Nevada, have expanded federal poverty level, but CMS allows that expansion up to 200%. This would be moving that. And so we looked at a total computable. And again, this is for the additional impact of covering those capitated member months within managed care, as well as the additional fee-for-service claims for that postpartum period of year. We currently, for those additional women that are covered up to 200%. And so there are two components of this. Again, one is the fiscal note that's quoted as $8 million in year one and $10 million in year two of state general funds. And there is an additional enhancement of $3 million in each state year, roughly, that if this committee were to consider passing the additional point of 12 months postpartum coverage that we do not cover, that would be covered in this period of covering those women up to those additional FMAP, because they would be covered for their traditional coverage as well as that extended portion. And seeing no questions, I will go to the last component, which is the 12 months additional of the postpartum. Currently, we cover up to 60 days postpartum, and then these women are then out of the market. And so this sole fiscal note looks at what it takes to expand that coverage for those additional 10 months. And again, those would be fee-for-service claims as well as managed care capitation for those additional 10 months. And so what we are looking at within the first year is an additional $7 million, and then an $8 million in the second year of the biennium, for a total of roughly $15.3 million state general fund over the biennium, knowing that it has impacts on those previous categories that I mentioned of including up to 200%, as well as the lawfully residing women, but not an impact on the presumptive eligibility.
Okay, thank you, Mr. Young. We appreciate that, and I apologize for any of the confusion. Committee members will make sure we get all these documents put together. Everyone gets them. We'll work through them. I'll work with Ms. Gorlow on it, and Mr. Young will probably have a conversation with you in the future just to make sure that we have this all lined out. I never thought I would see a Medicaid Christmas tree, but here is one right in front of us. So it's kind of an unusual situation. So with that, committee members, does anyone have any questions for Ms. Gorlow or Mr. Young at this time? Ms. Benitez-Thompson.
Thank you so much. I know we're going to work out the back piece of making sure our numbers kind of match up. But I guess as I read the bill, and I think what might be helpful is, so I love the idea. I think that we've had a few conversations in this building about preemptive eligibility for Medicaid, and I think have at least made one attempt in the past to try to get it to work, a couple attempts to get it to work. So it would be great to say, this is it, we're going to do it. But as I look through this, and I guess as we're moving forward with the conversation, should we take section 1 as kind of like a complete package, or if we figured out that in terms of affordability, we could do one piece of this over the other in terms of this population, do you have a priority or preference that you would, or thoughts that you would want us to hold in mind as we move forward on this conversation?
Thank you for the question. For the record, Assemblywoman Michelle Gorlow. If we had to take portions of this bill, I would say presumptive eligibility would be my first selection. I think that will allow us to really improve our early access to prenatal care, because what happens many times is women find out that they're pregnant when they're 6, 7, 8 weeks along, and if it takes an average of 45 days, if they have all the paperwork together, many times there's always a document that's not correct or they need to add something, so that adds longer onto the time when they're eligible for Medicaid. That takes them out of early prenatal care. So that would be my first preference. And then my next, I would say, eliminating the 5-year residency requirement for legal residents. That would be my next choice, followed by expanding Medicaid eligibility and then providing the postpartum care.
Perfect, thank you. And just as a quick follow-up, the expanding is the expanding up to the 200% of the federal poverty level, so that, okay, perfect.
Yes.
All right, perfect, that's helpful, I appreciate that.
Thank you very much. And Dr. Titus?
Thank you. Thank you, Madam Chair, for the question, and thank you, Assemblywoman Gorlow, for asking me to be a primary co-sponsor on this. I was excited to do so. It is a conversation that we've had multiple years, especially the presumptive eligibility. And I signed on because not only is it good health care, it's also good fiscal health care policy, because I know that by early intervention and health care for these moms, we have better babies. And so just kind of wanted to, on the record, and I know you can't give me a hard number, and I think maybe this is for Mr. Young. We've seen the cost of what this will be, but the other argument would be the savings, perhaps, it's hard to project, but if you could perhaps tell us, you gave a number, a hard number, because you had so many moms, say 2,800 moms, et cetera. Is there a ballpark figure that we know, and what the goal is as far as how much money we're going to save by maybe having, even if we saved one baby, on what the potential cost would be and potential savings of good outcomes?
If you don't mind, I'll go ahead and take this. For the record, Assemblywoman Michelle Gorlow, the average preterm birth is around 34 weeks, and the cost is between $65,000 and $75,000. So if we take an average of about $70,000 per preterm birth, it would actually take us less than 100 births to reach about $6 million. And I don't have a calculator off the top of my head, but then there's also the cost of like a 28-week baby. That baby averages about $250,000, so $250,000. So if we can take that 28-week baby and bring it to 30 or 32, that's going to cut down on NICU tremendously. Not to mention the long-term costs of early intervention, possible tutoring, physical therapy, the developmental delays. So there's more to that, in which perhaps Mr. Young can go more into. But currently we do about 3,800 preterm babies a year, so really less than 100 would get us at about $6 million.
Thank you for that, because I think that I wanted that on the record to know that that's really good health outcomes in the long run, saves dollars, and so it saves lives and saves dollars. So thank you, Madam Chair, for the question, and thank you for bringing the bill.
Thank you very much, Dr. Titus. And I remember I might have even been sitting in 4100 with former Assemblywoman Sheila Leslie with the Joint Health Committee meeting back in the early 2000s, trying to convince folks what presumptive eligibility really meant. And it was hard for people to wrap their brains around. I'm glad we're able to have this conversation again and in a very serious manner and start putting dollars to the conversation to see where we can go with it. So other committee members, are there any other questions of Ms. Gorlow at this time? We'll work on getting a more comprehensive document that reflects the bill in its first reprint so that we have one document to work from. And when we do that, then we'll bring it back in front of the committee to have more conversation about it. So with that, this is the hearing for Assembly Bill 189. I'll go ahead and open it up. Is there anyone on Zoom wishing to testify in favor of Assembly Bill 189? Not seeing anyone on Zoom. Is there anyone in the room wishing to testify on 189? No? Then we'll broadcast services, if we could go ahead and open up the lines for those in support of Assembly Bill 189.
If you would like to testify in support on AB 189, please press star 9 now to take your place in the queue. Caller with the last 3 digits, 199, please slowly state and spell your name for the record. You will have 2 minutes and may begin.
Thank you, Chair and members of the committee. My name is Tess Opperman. So that's spelled OPSERMAN, speaking on behalf of the Nevada Women's Lobby. We realize this is a money committee, so we'll keep our comments brief, but we did want to get our support on the record. Thank you for making time for this hearing tonight. We are in support of anything that is preventative care and can help women's health and family health. Thank you very much for your time.
Thank you. Broadcast Services, anyone else in support?
Chair, there are no more callers in support on AB 189.
Thank you very much. If we could go to opposition, please.
If you would like to testify in opposition to AB 189, please press star 9 now to take your place in the queue. Chair, there is no one to testify in opposition to AB 189.
Anyone in neutral?
Anyone wishing to testify in neutral on AB 189, please press star 9 now to take your place in the queue. Chair, there is no one to testify in neutral on AB 189.
Thank you very much. Is there neutral in the room? Ms. Grimmer? Did I breeze right by you earlier?
No, Madam Chair. Thank you very much for letting me come up late. Misty Grimmer, for the record, representing Silver Summit Health Plan. We're one of the state's 3 Medicaid MCOs, and we would actually want to testify in support. Thank you.
Thank you very much. So with that, seeing no one else wishing to give testimony, Ms. Gorlow, you have a little bit of homework in front of you. You can take care of that, and then we will have future conversations. So with that, committee members, we will go ahead and close the hearing on Assembly Bill 189, and we'll go ahead and open up the hearing on Assembly Bill 216, which Ms. Gorlow is handling also. Get these 2 out of the way. So with that, Ms. Gorlow, if you'd give us a high-level overview, and then we'll open it up for questions.
Great. Thank you very much. Again, for the record, Assemblywoman Michelle Gorlow. AB 216 requires the director to include in the state plan for Medicaid to pay for cognitive assessment and care planning for persons experiencing signs or symptoms of cognitive impairment. A fiscal note was submitted in the amount of a little over $900,000. However, I did receive an email from Mr. Dwayne Young on April 15th stating that the fiscal note was reevaluated and it has been removed.
Okay, thank you very much. Committee members, any questions of Ms. Gorlow? Yes, Ms. Miller.
Thank you, Chair. My question is just brief. When we say cognitive impairment, would this include anything that's related to Alzheimer's, dementia, accidents? What is there a standard for that?
Thank you for the question. For the record, Assemblywoman Michelle Gorlow. And yes, it does mean Alzheimer's, dementia, those type of impairments. However, it is not for someone who has like a concussion. It is meant for long term.
You're welcome. Any other questions at this time, Ms. Gorlow? Ms. Benitez-Thompson.
Thank you so much. So I guess since the provisions of the fiscal net have been removed, I guess I'm wondering, has intent or scope around the bill been changed? I guess there was a thinking about how this bill would be envisioned in one way, and there's been, I guess, a coming together of minds to realize that there's a path to walk forward that doesn't cost money.
Thank you. For the record, Assemblywoman Michelle Gorlow. It is my understanding that the cost was looked at what it would cost to put somebody in a facility versus the actual treatment, and that the treatment was less than the facility, and that's why the fiscal note was removed. But Mr. Dwayne Young might be able to provide more information on that.
Mr. Young?
Thank you, Chair Carlton and Assemblywoman Benitez-Thompson for the question. That is correct. I do actually want to just give thanks to Minority Leader Robin Titus, who helped us work with this as well, to look at what we did is we examined those individuals who are 55 to 65, those 65 and older would be dual eligibles and be paid for by Medicare. And so what we examined is that the percentage of individuals that we would test and would get this code, the savings for those and less than 8% who are actually in cognitive decline in this state, in that age range, the savings that we would get if we could provide other services such as home health, personal care services, just from those providing those services and not having them in the facility just for 6 months, then it would more than cover the savings of actually allowing this code to be open for those between the age of 55 and 65.
Ms. Benitez-Thompson, follow up?
Yes, so I'm following you pretty well, but could you restate all of it? So no, I'm fascinated. So I hear the dual eligible, I hear the conversation. So I see the part here about the state plan and Medicaid shall pay the non-federal share. So I guess, are you saying there's no upfront cost, or just the savings will eat the cost? So I'm hearing about the Medicare programs, right? So let's push them into home health and do those kinds of assessments. But I guess that the assumption would be the population has other care paths to walk into. So would there still be a portion of folks who don't have a path then that Medicaid would cover? Do you get what I mean? Or will everyone
Most
get picked
certainly.
up?
Again, Dwayne Young, Deputy Administrator for the record. Chair Carlton, through you to Assemblywoman Benitez-Thompson. Most certainly. And so you'll actually hear me again tonight speak about how we applied savings in different budget categories. This would all be within 3243. And so there's no system cost that we applied, because it's not creating a new provider type or developing or some lift. It's really just opening codes that are already existent within Medicaid to providers who would provide these assessments. And so what we assumed and what we know from research is that 7% roughly of the adults who are tested in this age group end up going into cognitive decline. So we base the savings solely off of that 7%. So we get to test the other 93%, even though they may not be in cognitive decline. They have the peace of mind and the insurance, and the savings is achieved off of those who are caught early, even if we only were able to stay in the nursing home 6 months. We thought that was a reasonable way to calculate savings, because that was based off of a couple different peer-reviewed articles, which really focused on the cognitive engagement piece and delaying of someone entering into long-term care facility by 6 months. And this was based out of a North Carolina study, as well as some additional studies that we looked at that really backed up this thinking. And so that is how we apply that across that spectrum. But it doesn't mean that every person is tested will be in cognitive decline, or that will achieve savings off of every person. But we estimated that off of what our current population is now.
Okay, thank you very much, Mr. Young. So with that, Ms. Benitez-Thompson, I'll go ahead and move on. Dr. Titus, did you have a question?
No, thank you, Chair. I think it's all been pretty well explained. Thank you.
Okay, and thank you, Dr. Titus, for your work with Mr. Young and Assemblywoman Gorlow to get this addressed. We do appreciate that. So committee members, are there any other questions of Ms. Gorlow or Mr. Young at this time? Not seeing any, so this is the hearing for Assembly Bill 216. The fiscal note has been removed. We will go to, is there anyone here in the room wishing to testify on Assembly Bill 216 in support? Ms. Grimmer?
Thank you, Madam Chair, committee members. Misty Grimmer with the Flower Group, representing the Nevada Alzheimer's Association. I know this is not a policy committee, so I won't go into the details. I just want to say thank you to the committee for processing this bill. It's a very important piece of legislation. And thank you, Assemblywoman Gorlow, for carrying the bill, and we appreciate it. And I thought I should add, my pot holder is still going strong.
22 years later, and I'm still working off of potholders. Okay, so with that, broadcast services, is there anyone on the phone line in support of Assembly Bill 216?
If you would like to testify in support on AB 216, please press star 9 now to take your place in the queue. Caller with the last 3 digits, 044, please slowly state and spell your name for the record. You will have 2 minutes and may begin.
Good afternoon. My name is Dr. Tiffany Tyler Garner, TIFFANY-TYLER-GARNER, and I believe this is an error. I was actually calling in to affirm support and endorsement of 189, particularly the commitment to presumptive eligibility in the ways in which it broadens health care access for many residents is of critical importance, and just wanted to affirm the support for it. Sorry for the error. Thank you.
No problem. Dr. Tiffany Tyler, don't worry about that. I will have committee staff take your support and put it in with Assembly Bill 189 with broadcast services and with the way this is working. This isn't the first time it's happened, and I'm sure it's not going to be the last in the next 18 days. So, but thank you very much for hanging in there and putting your support on the record. We appreciate it. So with that,
thank you.
You're welcome. Broadcast services, is there anyone else in support of Assembly Bill 216?
Caller with the last 3 digits, 199, please slowly state and spell your name for the record. You will have 2 minutes and may begin.
Thank you, Chair and members of the committee. For the record, my name is Tess Opferman. That's OPFERMAN, speaking on behalf of the retired public employees of Nevada. We realize this is not a policy committee, but we do want to be on the record in support, and we want to thank you for your time this evening. We do urge your support on this measure, and we hope you have an excellent evening. Thank you very much.
Thank you very much. Broadcast services, is there anyone else in support of Assembly Bill 216?
Chair, there are no more callers in support on AB 216.
Thank you very much. So can we go to those in opposition, please?
Anyone wishing to testify in opposition to AB 216, please press star 9 now to take your place in the queue. Chair, there is no one to testify in opposition to AB 216.
Thank you. And could we go to anyone in neutral, please?
If you would like to testify in neutral on AB 216, please press star 9 now to take your place in the queue. Chair, there is no one to testify in opposition to AB 216.
Thank you, and I believe we were on neutral, so we'll have to make sure that we're good. So with that, not seeing anyone wishing to testify, I believe that takes care of 216. I don't think Ms. Gorlow needs to do any wrap-up on that one, so we'll go ahead and close the hearing on Assembly Bill 216. And committee members, you may see this bill pop up again in the very near future, so be prepared. With that, I have Assemblywoman Summers Armstrong with us that came into the room, and I believe her bill is for Assembly Bill 256. We'll go ahead and open up the hearing on Assembly Bill 256. Welcome, Assemblywoman. Please give us a high-level overview, and we'll go from there. Thank you very much.
Thank you, Madam Chair, and thank you, members of Assembly Ways and Means. My name is Chandra Summers Armstrong, Assembly District 6, and I'm here today to discuss Assembly Bill 256, affectionately known as the doula bill. Assembly Bill 256 has a simple purpose, and that is to allow doula services to be covered by Medicare, pardon me. This is, having babies is a dangerous undertaking for women. We know that Black women have an exorbitantly high rate of mortality during childbirth, and we are hopeful that you all will understand the important role that doulas play in the birthing process. These are non-medical support folks. Their job is to provide emotional and educational information for the mom, to be there to be her advocate during the birthing process. And we believe that this will be a cost savings, as we know from national statistics that when doulas are present, births go better. And when that happens and women are able to have healthy babies, we save money. I would like to allow Dwayne Young from Health and Human Services to kind of break down the cost savings for you. And we can have some additional comments from Quentin Savoy from Make It Work Nevada, who was kind enough to bring this important legislation. Actually, let's switch it. Quentin, if you could just have a few words. I'm kind of nervous, I don't know why. And if Quentin could go ahead and sort of amplify some of the things that I said, and then we can go to Dwayne and give us the really important stuff, which are the numbers. So we'll tug at your heartstrings for a few more minutes, and then we'll go to the numbers. Quentin?
And please, Mr. Savoy, please keep in mind that this is not the policy committee, so if you'd like to make a brief statement, that would be fine, and then we'll go to Mr. Young for any follow-up. Thank you.
Absolutely, Chairwoman and Assemblywoman, thank you so much. I will just introduce myself. I'm Quentin Savoy, the Deputy Director at Make It Work Nevada. We work alongside Black women and Black families to build power for economic, racial, and reproductive justice. Indeed, I understand this is not the policy committee, but I did want to outline that this is community-driven policy. We've hosted a litany of what we call kitchen table conversations, one-on-one conversations with community members about what their healthcare experiences have been and what their experiences with their doctors have been. And what we found was especially devastating, but also motivating, because what we learned was that there is something we can do about this. When we researched expansion for Medicaid for doula services in other states, it not only was a cost savings to the state, it got the kid off to a fresh, healthy, whole start, and it improved the birth outcome for the birth parent. So at its core, this bill is about Nevada's kids and getting them started freshly and making sure that we're thinking about the mothers that are going to be birthing these children and making sure they have successful birth outcomes as well. We can do something about this, and I hope that we do. Thank you so much, and I'll defer to Mr. Young.
Thank you, Mr. Savoy. Mr. Young?
Sure, Carlton. Again, for the record, my name is Dwayne Young, Deputy Administrator for the Division of Healthcare Financing Policy. I just want to thank the work that we did with Mr. Savoy and Make It Work in community organizations over the last year, and the work with Assemblywoman Summers Armstrong shortly after her election allowed us time to do some peer-reviewed research. And so we based this fiscal note off of, there's an immediate savings, one, and kind of the discussion earlier, with Assemblywoman Gorlow's bills, the savings that could apply with NICU babies. So you'll hear us break that percentage down. We know that we will always have some babies in the NICU, but we know we can have better outcomes. And so we've applied some of that savings across each bill. But where you'll see the most immediate savings is the difference, because Medicaid has a different reimbursement for a vaginal and cesarean birth, is the direct outcomes. And we based this on peer-reviewed research that looked at other states-specific Medicaid outcomes of decreasing the number of cesarean births and increasing the number of vaginal births by the women who had these doula coaches. What you'll see is demonstrated within the fiscal note is that we estimated a very modest 6%. And so we knew that not everyone will embrace these services, the availability of these services, but if we could increase 6% of the women to utilize these services, that's also based on the number of doulas already existed within the state, particularly if we could see better outcomes in urban and even in our rural areas with their confidence of engaging with their practitioner. We've had some discussions over how the quality of care plays into the experience of the mom. So we estimated that if 6% of these women took these services, the state would see an immediate savings of about $400,000 in year one of the biennium and $800,000 in year two of the biennium, giving us a combined effect of nearly $1,600 effect on the biennium. There is one direct cost, and that is out of 3158. The savings comes out of 3243. 3158 has system cost of around $58,000 that we've included in this note. That is the cost to create a new provider type, because we want this to be its own provider type, and that will allow us to track for data purposes and research purposes so that we can publish some of those articles on savings. So there will be an ask there will be a division's need to transfer medical savings from 3243 to 3158 as part of system hours. As you are quite aware, and the committee is quite aware, you do approve our administrative budget in 3158, and some system hours are maintained in that. But in order to do some of these extra things, we do have to get more system hours from our vendor. And so what we are asking is if we were allowed to transfer those funds, to our administrative, or front those funds out of our administrative budget and cover them later, we know that we would see an immediate savings of impact from getting this service out within that savings between that cesarean and that vaginal rate.
And thank you, Mr. Young. So, and that's where my line of questioning was going to go. We appreciate the fact that this will now be billable, that there are prospective savings in the future. We also realize that there is a cost actually implementing this, and the state portion of the cost would be $14,500, if I understand correctly. And you're proposing to pay that out of your administration budget moving forward? Is that what I heard?
Again, Dwayne Young, Deputy Administrator for the record. So we always pay anything that is system cost or expenses. We always pay those out of our administrative budget. What happens, and you of all people know well, and this all committee knows, we've had to come to transfer funds from other budget categories to administrative when we've had unforeseen system cost. And so we know that these are bills that are not accounted for in our current budget that will be closed tomorrow. And so it won't be discussed. And so we want to have the ability to reflect them within the fiscal note, but know that we could cover them through the savings in 3243.
And thank you, Mr. Young, for putting that on the record. We appreciate that. So with that, committee members, there are questions. I will go to Majority Leader Benitez Thompson.
Thank you so much. And so as I'm reading the methodology on the fiscal note, I just had a couple of questions so I make sure I'm understanding right. So the estimated number of births a doula would support, then multiplied by $350, and that I'm looking at your subnote 6 under the methodology, and that this was a comparable rate from Oregon. So does that mean that this is going to be capitated, right? Yeah. Part of the capitated plan. So does that mean that it's I guess the rate for the doula is $350 for a birthing event? Kind of, I guess I would say soup to nuts, or I could probably come up with a better analogy, but I don't trust myself.
No. Okay. The speaker stepped out. We're safe for a moment. Okay.
Thank you. Thank you, Assemblywoman Benitez Thomas. The example that is in the backup documents is a total of 5 visits. It is 2 pre-birth, the birthing event, and then 2 post. And that is where the $350 comes in.
Perfect. I appreciate that. So $350 for the 5 visits, and then the savings assumed are $986 per birth supported by doula. So is that, I heard the reference, I see a reference to a cost effectiveness study. I also heard the reference to savings for avoiding cesareans. And so is that $986, it's a savings because they're delivering vaginally, or it's a savings because just supports? I guess I wanted to kind of nail down a little bit more that 986 number. And that's the subnote 7 on the methodology.
Deputy Administrator Dwayne Young, for
Thank
the record, Chair Carlton, through you to the Majority Leader Benitez Thompson. Yes, that is exactly, that savings is based on the difference between the vaginal and cesarean birth, but then it's also calculated the overall outcomes. And so there is a percentage that we did look at, very small percentage of NICU births and birthing outcomes, but that is largely reflected by the difference between the vaginal and cesarean birth and those direct studies that focused on the differences within Medicaid and the increased outcomes with Medicaid programs.
Sorry, just quick follow-up. So I guess what the 2016 study on the cost effectiveness then for doulas is telling us, I guess what we're seeing is a stark difference between those who deliver with one versus those who deliver without one. And I would say the modality of the birth. I don't know what else.
Again, Dwayne Young, Deputy Administrator for the record. Majority Leader Benias Thompson, yes, that is correct. And I will just add that this committee, and it was of hot discussion during last year's Medicaid budget work session about some data that we quoted about the experience of women in Nevada and their lack of favorable experience leading to bad outcomes. And so this service, what cannot be discounted, I know we do not discuss the merits of the policy, but what cannot be discounted is the advocacy on behalf of those women to be a voice to speak up to their provider, to help their experience has direct impact on the fiscal cost and their ability to have a successful vaginal birth.
Thank you very much, committee members. Any other questions of Mr. Young or the Assemblywoman? Not seeing any other questions at this time. So, Assemblywoman, I believe in discussing with staff and the proposal that Mr. Young brought out about being able to use dollars and transfer dollars, we had thought we might needed some transfer language in the bill, but it looks as though we would be investigating just adding some back language to the bill to make sure that Medicaid has the authority to do what it needs to do. In this room, we call it a technical adjustment, but we'll make sure that there's some language to make sure that what you're trying to accomplish, you can actually get done over the interim. So, Dr. Titus, did you have a question?
Yes, thank you, Madam Chair. Mr. Young, I guess for clarification for me, early on in the testimony, it was stated that this is for non-medical services. And so we're paying for a non-medical service. I'm just wondering about, are there other, just for our reference, other services that Medicaid pays for that they define as not medical?
Again, thank you so much, Assembly Minority Leader Titus, for the question, Dwayne Young for the record. And so Medicaid, we know that they must meet a level of medical necessity. And so this is, and we wanted to make it clear that it's not medical because it is being added under the medical category and would be contained in our physician services. Medicaid pays for services that allow for advocacy all the time. We pay for targeted case management. We pay for support through the waivers. Just last year, we approved attendance supports, and we have supports through specialized foster care. So there are medical advocacy would probably be a better term than non-medical service. But Medicaid certainly has a history and does pay for these services and sees outcomes from those services as well as when there is someone that is able to help the recipient advocate on behalf of themselves.
Excellent. That's exactly what I wanted to get on the record. Thank you, sir, for your answer, and thank you, Madam Chair, for the question.
You're welcome, Dr. Titus. Any other questions or comments from the committee members at this time? Not seeing any. This is the hearing for Assembly Bill 256. We'll go ahead and open it up. Is there anyone here in the room wishing to testify in support of Assembly Bill 256? Not seeing anyone. We will go ahead and go to Broadcast Services. Broadcast Services, do we have anyone on the line in support of Assembly Bill 256?
If you'd like to testify in support on AB 256, please press star 9 now to take your place in the queue. Chair, there is no one to testify in support on AB 256.
And thank you so much, Broadcast Services. Can we go to opposition, please?
If you would like to testify in opposition to AB 256, please press star 9 now to take your place in the queue. Chair, there is no one to testify in opposition to AB 256.
And thank you very much. Anyone in neutral?
If you would like to testify in neutral on AB 256, please press star 9 now to take your place in the queue. Chair, there is no one to testify in neutral on AB 256.
Thank you very much. We'll close the hearing on Assembly Bill 256. Thank you very much, Assemblywoman, for being here this evening. We'll investigate what we need to do next and proceed from there. So with that, we'll go ahead and go back up to the top of the batting order, which would be Assembly Bill 191. We have Dr. Assemblyman Mr. Orlicker. Welcome to the committee again.
Thank you, Chair and members of the committee. For the record, I'm David Orlicker, Assembly District 20. I'm here to present Assembly Bill 191 on behalf of the Legislative Committee on Healthcare. And this bill would require Medicaid to reimburse services provided by community health workers. And the idea here is to increase the health system capacity for prevention and early intervention, and as a result, to realize cost savings. Community health workers do valuable work with educating patients, screening and risk identification for serious diseases, and also chronic disease management. As a result, we see a reduction in emergency department visits and hospitalizations, and hence the very nice fiscal that Dwayne Young will now walk us through. So thank you.
Thank you very much. So with that, Mr. Young, if you'd give us a brief walkthrough on this one, and then I think we need to have the same conversation about the MMIS system that we had on the previous bill. So please, go ahead.
For the record, Dwayne Young, Deputy Administrator for the Division of Healthcare Financing and Policy. And so this fiscal note is demonstrated by the support that community health workers, and again, this would be classified as a non-medical services, but advocacy support and educational service. And so this services really focuses on helping the recipients and the provider manage the recipient's chronic conditions. And we were able to provide testimony throughout the years that this would, the role of community health workers has been highlighted by the COVID-19 pandemic. I know we're not here to discuss the merits of that policy, but I did just want to set that up because it is very similar to the last service in that aspect. This fiscal note is demonstrated by, again, out of budget account 3243, if we were to allow for community health workers, and again, we associated this note and we built this off of a rate, what the cost would cost in managed care and in fee-for-service. It is actually a little bit higher in fee-for-service because we know that we have higher instances of chronic disease and the populations that we have within fee-for-service that don't have as many supports, those in the rural populations and those in the traditionally medically age, blind, and disabled category. And so we see there that if we were to allow community health workers, we would see a 2% reduction in services from the result of those that utilize the community health worker. And so just with a modest 2% estimate, we were able to estimate that we would see a savings of about $342,000 in the first year of the biennium, and then $837,000 within the second year of the biennium. The system cost exhibited in budget account 3158 is roughly about $50,000. And so again, it would be the same to be able to demonstrate if we were to upfront the system cost in our administrative budget, but then be able to transfer funds to cover the work that was done. Within the first year, if we could get that off the ground, we would see that savings back, plus an additional roughly $300,000. I think it is just worth pointing out that we've had this discussion at the legislature several years. And so we have always in previous years brought this as a zero impact, but because of our work in the interim with the interim health committee and various stakeholder groups, we were able to really apply specific peer-reviewed articles that focus on Medicaid and the impact that community health workers have. That doesn't even touch what obviously the COVID-19 pandemic has magnified the importance of community health workers, and so that wasn't even accounted for in our research. But we didn't want to over-project, but we did want to give this committee an accurate projection of what savings would look like.
And thank you very much, Mr. Young. I think there's one other item I would like you to address. With the effective date of 2021 in this would be a change in mid-year certification for the managed care. So would this have an impact on that? I know it has to meet a certain threshold before it would impact that mid-year certification. So where do you stand with that with this particular effective date, and is this the appropriate date?
Certainly, Dwayne Young, Deputy Administrator for the record. And Dr. Casilius can correct me if I'm wrong, but we did not actually include capitational adjustments because of the small size of this service. And so it does not trip that threshold that you see demonstrated in our other fiscal notes. What I might add is that many of our managed care organizations have been already using community health workers, as well as many grants have stood up community health workers across. And so when we talk about standing up new provider types, there is some difficulty often within Medicaid, but this is not one because they already have certain certifications and requirements. There are many entities already using them. And so this would be just a simple, easy, and standing up the system to prepare them for a simple, easy enrollment into Medicaid.
Right. Thank you very much, Mr. Young. I just wanted to make sure that we got that on the record. I know that threshold can be bumped up against at sometimes. So with that, committee members, are there any questions of the Assemblyman or Mr. Young at this time? I believe the same issue would apply to this bill, 191, that applied to Ms. Summers Armstrong's bill earlier about the state portion that would be needed, the transferability that you would need within your budget accounts. We double checked the back language, so there is a provision that we can use. So we don't slow the bills down. The bills won't need to be amended with that, but we can make sure that we give you that authority as we move forward if the bill gets processed. So thank you very much, Mr. Young. Committee members, any other questions? Not seeing any at this time. So with that, this is the hearing for Assembly Bill 191. We'll go ahead and open it up. Do we have anyone here in the room in support of Assembly Bill 191? Anyone? And let's go to Broadcast Services. Broadcast Services, do we have anyone in support?
If you would like to testify in support on AB 191, please press star 9 now to take your place in the queue. Caller with the last 3 digits, 324, please slowly state and spell your name for the record. You will have 2 minutes and may begin.
Good evening, Chair Carlton and members of the committee. I'm Steve Messenger, STEVEMESSINGER, with the Nevada Primary Care Association representing the state's community health centers. We enthusiastically support AB 191. Health centers have seen firsthand the savings to insurers from CHWs when a patient connects to a specialist, completes a test or screening, or is able to access transportation vouchers to reach their appointment. We submitted further comments to the committee yesterday. I would like to thank Mr. Young and the division for their years of work to find a path for financing CHWs, and we're also grateful to members of the committee and to you, Madam Chair. Thank you, and please pass AB 191. Thanks.
Thank you very much. Broadcast Services, anyone else in support, please?
Chair, there is no one else to testify. Oh, pardon me. Someone just raised their hand. Caller with the last 3 digits, 044. Please slowly state and spell your name for the record. You will have 2 minutes and may begin. Pardon me, Chair, but the caller dropped off the line when I asked them to unmute.
That's
So
fine.
we have no more callers in support on AB 191.
Okay, let's go to opposition for 191, please.
If you would like to testify in opposition to AB 191, please press star 9 now to take your place in the queue. Chair, there is no one to testify in opposition to AB 191.
Thank you. And those in neutral.
If you would like to testify in neutral on AB 191, please press star 9 now to take your place in the queue. Chair, there is no one to testify in neutral on AB 191.
Thank you very much. So with that, I believe we can go ahead and close the hearing on Assembly Bill 191. Folks, keep it close. I think this is one we might be able to deal with also, to keep our decks cleared. So with that, committee members, our last bill that we have listed for this evening is Assembly Bill 358. It has the speaker's name on it, but he will not be presenting. We will be having the folks from, I believe, Corrections.
Madam Chair, if I may, Assemblywoman Nguyen presented this bill and has been handling this bill, and I don't think that anyone notified her to be here. So if
I'm sorry about that.
If there's someone available to address the reason that it's in ways, then so be it. Otherwise, I'll have to coordinate.
Mr. Speaker, would be happy to roll this to another time if you would like. I apologize if the word didn't get to the right person. I thought we did, but so I'll make sure that Ms. Nguyen is notified, and then not sure if we're having another meeting this week.
Apparently, she is on her way.
Okay, we'll take a moment then.
Madam Chair, if I may, as Assemblywoman Nguyen makes her way in, it appears that my attaché was notified, but because I didn't present the bill and don't have a folder on the bill, maybe he just thought I get notified about everything. So Assemblywoman Nguyen was not notified, so we were willing to roll it, but I appreciate Assemblywoman Nguyen coming down nevertheless.
And be happy to give you a moment to get settled, take a breath, and then we can proceed.
Perfect, thank you.
It's that time of session where we do a lot of pinch hitting for each other, so we understand that. Whenever we have one of these pauses, I always hear the Jeopardy theme in the back of my mind. Don't start. Ms. Nguyen, that's strike two. Are you sure you want to proceed? Do you need a pot holder? No, there we go. You had to be here, I'm sorry. We'll take that out of the minutes, I'm sure. Somebody needs to double check the minutes for tonight for me. No, it's quite all right. We're good. I just have to make sure some of the folks get out of here before the street lights come on so they don't get in trouble when they get home. So I do believe we have a couple of folks on Zoom. If the folks who are here for Assembly Bill 358 could go ahead and turn their cameras on, we would appreciate it. And if whoever wants to flip the coin, oh, there's 3, you can't flip a coin. So whoever would like to draw the short straw and give us a brief overview of Assembly Bill 58 and then walk us through the fiscal note, that would be very helpful. So, ladies, gentlemen, who would like to proceed?
I can start, if that's okay,
Ms.
Madam
Nguyen,
Chair.
go ahead.
Rochelle Nguyen for the record, representing Assembly District 10. Essentially, what Assembly Bill 358 is interesting because it was brought by 3 different members of the legislative body this session. So the one that we are hearing today is 358. It enacts provisions that improve access to Medicaid for persons released from incarceration. So currently, the way it works is we are not signing up eligible members for Medicaid prior to their release from incarceration from NDOC and other facilities. And everything from their medication and their treatment is coming from like general fund dollars, essentially the NDOC's budget. And so this would actually alleviate a lot of those extra costs that are incurred in the prisons, because instead of us paying for 30 days cash of people's medical, like their medicine, they would be covered under Medicaid. It would also help with the continuity of care because they would be set up. They would have providers that we would be able to work with. If they're on parole, they would be able to work with their parole officers and have that kind of continuity of care that is required for them to be successful once they are released, either after expiration of their sentence or after being released on parole. So that's kind of a basic overview of what the bill intends to do. I see that there are fiscal notes on here, and I will allow them to present what they are and walk those through if that's with your permission, Chair.
And thank you very much, Ms. Nguyen. So if someone was already on Medicaid, this would just allow it to go into a pause rather than be terminated and have them have to reapply again. So if they went into the institution with Medicaid as they prepare to leave the institution, that Medicaid could be reactivated there for whatever health care they would need as they leave. There wouldn't be that 45, 60 days of them waiting to get the medications that they would need to succeed or any other health care. The question I had, and we've had this conversation about the folks leaving prison a lot, is them not having ID. So by doing this, these folks would actually have a Medicaid card, which would be another form of identification. So was that discussed in the committee? Because that's been an overarching issue for years, folks having ID when they leave. So was that part of the conversation as the bill has been moving forward?
I believe we passed some legislation last session during the 2019 session that did allow for individuals that were incarcerated to get identification. I know that NDOC actually brought a bill that I think has already made its way through the Senate, if I'm not mistaken, that did allow them to get birth certificates for all individuals that were incarcerated. Prior, it had to be like a couple months or a month before or after their release. And so there was a bill, and I apologize, it was like, I want to say it was maybe Assembly Bill 19 or 16, that allowed for them to get the birth certificates to be able to facilitate not only with identification, but also obtaining these resources. I don't know if that kind of answers your question.
And that helps, but in addition to that other documentation, then they would still have a Medicaid card when they left, so they could just, instead of having to fly over, they could just get the card back and move forward from there. So I'll go ahead and go to the department to have a conversation about the submitted fiscal note and the reason behind the fiscal notes. Do we have someone from the department?
Madam Chair, this is Elizabeth Dixon Coleman with the Nevada Department of Corrections. Are you referring to us? We have a fiscal note attached.
Yes, please.
Okay, thank you, Madam Chair. Elizabeth Dixon Coleman, statewide reentry administrator for Nevada Department of Corrections. We attached a fiscal note. We've been running a pilot program based on the back of AB 236 and the legislation going forward with that, and working with DWSS and DHHS and making sure that we could capture Medicaid based upon the laws that are already in place. In that 60 to 90 days release, we've been actually doing since July in pilot fashions to make sure that we could, even during COVID times, reach and make sure that we reach into those components to ensure that they do have that identification and those pieces in place. We've been utilizing program officers that were funded through the department, through the general fund, and under other funding based for our vital records department, and ensuring that we could go forward to give numbers for statistics for build out with that. With that, we release approximately 6,000 individuals per year, and in that, based upon our numbers that we've collected during this short period of time from July until now, we came up with the formula to come forward with the program officers and other support pieces that we would need to do to back up DHHS and DWSS in order to make sure that this is successful.
Okay, I'm going to have a question here. So you already have program officers that process folks as they leave the institution now. This would be one more component of processing someone out. So I guess I'm trying to wrap my brain around why we would need so many extra people. I mean, I could understand the workload, it taking a bit of time for each one, but it's hard for me to imagine that, I believe you said 6,000 people, that you would need this many more folks to handle that one function for that particular inmate leaving the institution. So how did you come up with a program officer 2 and all these program officer 1s for this bill?
Yes, Madam Chair, if I may go ahead and answer your question. In doing that, program officers have a dual role of doing evidence-based inspection as well as any identification and leaving. SB 236 had put additional caveats on those pieces, one of which was Medicaid. Up until this point, Medicaid was only processed if it was requested by the resident themselves, the inmate themselves. It was not a mandate to process for all. Under this law, in going forward, it would process for anybody that was leaving to determine their eligibility based upon the qualifications from DWSS and DHHS for that. And so the application itself is approximately 14 pages long. In being 14 pages long and processing that for every person that would be exiting, as the law has stated, the timeframes to do that, the timeframes to make sure that we can process that and get that actually over to the respective department, it was taken into consideration to this piece, so that we would have someone that was solely in charge of making sure that they go forward with each of these components based upon the needs of each of the institutions. Our numbers were processed in a small number, again, by request only, 60 to 90 days. This would open the window so we could start at any time, put it into suspension. It would remain in suspension for up to a year once they are approved, should they be approved for this. And that would leave us to go forward with these components. Because of the processing time, because of the way in which we have to process these, we do not have an electronic processing component to this. We don't have the infrastructure nor the supporting abilities to do this. By the time you take that data consideration into that and coming forward and asking for a program officer 2 to do the supervisory component to make sure that all those pieces in each of our respective institutions are gained, is why we put forward this fiscal note.
And thank you very much for that explanation, but I'm going to make a suggestion here, and I'm not sure if Mr. Young or someone from Medicaid is still on the line, or one of them are listening. So is there an opportunity for the Department of Corrections to partner with Medicaid to set up a phone line to actually have the inmate do his own application remotely? Medicaid does eligibility. That is their life. That is what they do. It seems to me as though we're recreating the wheel here in creating program officers to do eligibility when Medicaid currently does eligibility. And is there a way within the Medicaid regime to allow these inmates to access that in a safe and secure way, protecting those in Medicaid, making sure that we have the right protocols in the institution for this to happen, and take NDOC out of the middle for a portion of this and have Medicaid do the thing that they do so well? Mr. Young, I'm throwing you a softball here.
Good evening, Chair Carlton. This is the eligibility portion handled by the Division of Welfare and Supportive Services.
Okay.
So my colleague, Mr. Joe Garcia, is on the Zoom. So he'll actually walk you through the eligibility portion.
Mr. Garcia.
And Chair Carlton, Rochelle Wynn for the record, just so you know, this is also something that was brought up during the committee hearing. Director Whitley had indicated that he has tried for years to work with NDOC to be able to do this, but I'm sure Mr. Garcia can go through it in greater detail.
And that's who I learned it from. That's why it's in my brain. So, Mr. Garcia.
Yes, Joe Garcia, Chief of Program Operations, Support and Training for the Division of Welfare and Supportive Services. So we have been working with Department of Corrections since July of last year. We started a pilot project providing applications to the Department of Corrections so that we could get inmates on Medicaid prior to them being released. Well, not prior to them being released. Let me correct that statement. Determine eligibility, put them on what we call suspended Medicaid. So basically saying this person is eligible, but we're going to put them in a suspense. We use a certain code. They show up as suspended. When we get notified from the Department of Corrections that the inmate is released, we then go into our system, change the code, and make them eligible. Unfortunately, they do not receive their Medicaid card until we change the code to show them as released and eligible. So that card gets mailed to the address that was listed on the application. There is an opportunity for them to call once they're released, or maybe even prior. It just depends what Department of Corrections is allowing. They can change their address and the card will go to that address, or they can walk into an office and request a card, or change their address there at the office, and we will get them or get one mailed out as soon as possible. So they won't have the card, but we can issue them the Medicaid billing number, because we do get that right away when we put them into our system. And that they can go and see a doctor. It takes about, and Dwayne can correct me if I misspeak here, but it takes about 24 to 48 hours for the system to show them eligible. So if they walk into a pharmacy the day they walk out of prison, more than likely they are not going to show eligible. It's going to take, like I said, 24 to 48 hours for them to actually show eligible. That is something that we haven't been able to change, and I don't know that we can change it. The other thing that Department of Corrections that Elizabeth Coleman was mentioning is the application. The application is 14 pages, but it's double-sided. So it's actually 20 some odd pages. We are working on trying to get another application through CMS, but we haven't had any luck with that yet either, and don't know if we will. because we do understand shortening that application would be a benefit to the Department of Corrections, especially because they're single households. It's one person. And we don't need a lot of those questions that are on our basic application. So there was another question about, let me think here. There was one more question. Oh, phones. So we do have a call center that we can have, that we actually take applications over the phone. And we could set that up with Department of Corrections, but I think Department of Corrections and Elizabeth can certainly speak to this. There may be some security issues with the inmates using the phone. If they could be provided a phone, and that I'll let Elizabeth answer, but we can certainly work something out if they're allowed to use a phone. I will say that we have offered a couple of different options, but with COVID and the lockdowns and the short staff that, or the staffing situation that the Department of Corrections was facing, kind of interfered and hindered our progress. It's not that Department of Corrections wasn't trying. They were trying. They're doing the best they can with what they have. And we have been receiving applications on a monthly basis from them. Would we like larger numbers? Yes, but we totally get what's happening at Department of Corrections. I mean, there's nothing we can do about the lockdown. And we have been assured by Department of Corrections that coming out of COVID, we would see some larger numbers of applications, and we have. So they are trying, I will say that. And we will do whatever we can to make it more convenient for the inmates to apply for Medicaid. And we can't do it over the phone. However, there will be some work involved with that, because that call center I'm talking about is for the entire state. So there's sometimes, as I'm sure you've heard, there's sometimes they're waiting 30 minutes, 40 minutes. It just depends on what time of the month it is. Our staffing at the time, we do try to staff it. We have backup staff that come on if we get past a threshold. And, but like I said, we can certainly work on working with Department of Corrections to try to get some kind of phone set up. But again, that's Department of Corrections call as to whether or not security there would allow for inmates to have access to a phone before they leave.
And thank you very much, Mr. Garcia.
And when I say that, I'm sorry.
And thank you very much. I think I'm going to, Speaker Frierson, did you have a comment at this time?
Thank you, Madam Chair. You asked the main question that I was going to ask, but I just want to point out that this is done elsewhere without a cost associated with it. And I would imagine significantly more volume and frequency when the Clark County Detention Center can do it without an additional cost. In my career, I know that whether it's NDOC or the local jail, inmates have to be accommodated to talk to their lawyers. So there are phones. It's not like they're sending homing pigeons out. They have to be able to talk to their attorneys, and they have to be able to do it in private. And so this would seem to me to be an opportunity to defray costs of medical expenses as folks are transitioning out. And I'm just a little surprised at the reluctance, especially recognizing that there's been efforts to address this for some time now, that an effort to partner up with insurance companies or any other entity or Medicaid directly to make this happen just seems to me to should be a priority, and it feels like there's kind of excuses, quite frankly.
And thank you, Speaker. So with that, I think I'd like to go back to NDOC. After hearing this conversation, and see if they have any observations or comments, and I would ask you to look into working with eligibility to figure out a way to move forward. I understand the numbers you're talking about, but it seems to me as though there might be a system out there that may work better for you. So have you investigated any of these possibilities, and where do you think you're going from here so that we know what we're looking at?
Madam Chair, Elizabeth Dixon Coleman for the record, Nevada Department of Corrections, statewide reentry administrator. Yes, in the pilot, we have looked at some of these things. Because we're looking at a larger release number, several things have come into play. As Assemblyman Frierson actually brought forward, CCDC and some of the other facilities actually have had an individual go in from DWSS and DHHS to make sure that they can help gather those. Those are one facility working with one release coordinator. We have 18 facilities statewide, which are scattered all over the place, primarily with a cluster in the northern area and the southern area. However, we do have rural facilities that we do release from, depending on as we go forward with that. The accessibility to the telephone, one of the things that has come out of our working group, we meet monthly with both agencies to make sure that we can go forward to see the best way we can tackle this in honoring not only AB 236, but any current legislation going forward with this. And in these monthly meetings, one of the pieces was the security compliance for HIPAA and security components to make sure in transferring data back and forth between the agencies and sharing those things. And then also the accessibility of, if we would utilize a telephone line in those ways, would we have dedicated lines, dedicated services, et cetera? Neither of those agencies have that staffing ability to do that. So one of our largest pieces was to go forward with the paper application in which we are transferring back and forth between the agencies to ensure that accessibility to that. And in the paper application and going through some of the components, many of the residents need time to think and to understand and to walk through with time questioning with someone assisting them on a one-to-one basis. Healthcare is complicated for most of us in general, but those that maybe have had a more varied life and not been involved with the healthcare component in any way, many of these questions can often be confusing. So we opted to do the paper application in that time frame. We were COVID, so we have been in talks about will the agencies DWISS and DHHS have the accessibility to send actual workers from them to come in to assist with our pieces with numbers, should questions need to be answered, et cetera. They're looking into some of those things, but to ensure that we're going forward with that, we opted again for the paper allocation for that component. And with that, in the small numbers that we were doing, again, it was by request and 60 to 90 days to release for those that would be eligible under that component for us applying. We do, yes, get back a component, but we're also making sure that we're monitoring and tracking and recording that data, in which we're sharing back and forth between DWSS and DHHS and our own, so that we can have their website match the data that's actually coming from the Department of Corrections to actually paint that varied, deep picture, so that we're not constantly coming back and asking in interim finance as we build onto these components, but ensuring that we could do this in the best quality way and going forward is the reason why we presented forward with the fiscal note as we did, ma'am.
And thank you very much. This is a lot of moving pieces and parts, but I have to say that I would have more concerns about the paper document and security than I would about a phone call. So I hope you'll take that into consideration, and also the speaker's comment about a secure line and confidentiality when speaking to your your legal representative. So with that, committee members, I think we've asked enough questions. Thank you, Ms. Nguyen. We're going to keep digging into this one and see where we can go with it. So seeing no other questions or comments at this time, this is the hearing for Assembly Bill 358. So I'm going to go ahead and open it up. Is there anyone in the room in support of Assembly Bill 358? Not seeing anyone in support. With that, we will go to the phone lines. Do we have anyone on the phone in support of Assembly Bill 358?
If you would like to testify in support on AB 358, please press star 9 now to take your place in the queue. Chair, there is no one on the line to testify in support on AB 358.
Thank you very much, Broadcast Services. Do we have anyone in opposition, please?
If you would like to testify in opposition to AB 358, please press star 9 now to take your place in the queue. Chair, there is no one to testify in opposition to AB 358.
Thank you very much. Do we have anyone in neutral?
If you would like to testify in neutral on AB 358, please press star 9 now to take your place in the queue. Chair, there is no one to testify in neutral on AB 358.
Thank you very much. So with that, we'll go ahead and close the hearing on Assembly Bill 358. Thank you very much, Ms. Nguyen, for being the pinch hitter. There's a little bit more work to be done on this. We'll follow up with the appropriate folks and see where we can go, and I'm sure you'll follow up with them also. So thank you very much. So with that, committee members, I believe there are a couple of bills that we can move this evening. We can get them reported out and keep things rolling towards the Senate. So hold on for just a moment, and we'll go through the list here. Right, committee members, so for the public's information and for yours, I believe we can go ahead and move some bills this evening. The two that we will not be moving are AB 189. Ms. Gorlow is still going to work on that with Mr. Young and combine those fiscal notes together so we have a comprehensive fiscal note to look at. And Assembly Bill 358, which we just discussed, needs some more discussion. So with that, the other bills that we heard this evening, the chair is comfortable in moving. Do any of the committee members have any concerns on any of those bills at this time? Not seeing anyone wishing to be recognized, we'll go ahead and turn it over to Ms. Kaufman, and we will just go through the bills in order. So, Ms. Kaufman.
Thank you, Madam Chair. Assembly Bill 191 requires a state plan for Medicaid to include coverage for the services of community health workers under certain circumstances. There was a discussion related to a savings that was provided in fiscal year 2022 of $342,446, and in fiscal year 2023 of $837,243 in fiscal year 2023. Would note that there was also discussion related to expenses that would be incurred through the Medicaid Management Information System that would require expenditures of $49,500. And Mr. Young testified that they would be able to transfer some of the savings that would be provided in budget account 3243, which is the Medicaid account, to the administrative account to support these expenditures. Assemblyman Ortlicker was the presenter for this bill, and there were 2 individuals that testified in support for it.
Thank you very much, Ms. Kaufman. And with that, we would want to include the provision to add into the back language the transfer authority from Medicaid to be able to transfer those dollars from one account to another to deal with the administrative fees of the MMIS system. Is that correct?
Madam Chair, that is correct. That language can be added to the Appropriations Act.
Okay. So in that particular section of that Appropriations Act committee, when we get it, you'll find it, and it'll have a number of bills, numbers in it, and that's where we're giving we do not give blanket authority to do this, but we give it for the authority for individual bills to make those changes. So, are there any questions or comments on Assembly Bill 191 at this time? Not seeing any. I would accept a motion to, okay, wait a minute. This is where they try to, oh, it's not been worked on. So, I would accept a motion to do pass Assembly Bill 191.
So
from
moved.
Ms. Benitez Thompson, a second from Dr. Titus. Any questions or comments on the motion? Hearing none. All those in favor, please signify by saying aye. Aye. Any in opposition? Hearing no opposition, passes unanimously of the members present. Ms. Monroe Moreno, would you take care of this one on the floor, please? Yes. Okay, got that one. So that's 191. Moving on, Ms. Kaufman. Michelle.
Thank you, Madam Chair. The next bill is AB 216. As amended, requires Medicaid to cover cognitive assessments and care planning services for persons who experience signs and symptoms of cognitive impairment. I would note that there was a fiscal note on this particular budget, but the Division of Healthcare Financing and Policy provided an email indicating on April 16th that the fiscal impact had been removed. Oh, I'm sorry, and the presenter of that bill is Assemblywoman Gorlow, and there were 2 individuals that testified in support.
Thank you very much, Ms. Kaufman. So committee members, are there any questions or comments on Assembly Bill 216? Not seeing any. I will take a motion to do pass as amended, Assembly Bill 216. I have a motion from Ms. Benitez Thompson, a second from Ms. Monroe Moreno. Any questions or comments on the motion? Do pass as amended. All those in favor, please signify by saying aye. Aye. Any in opposition? Hearing no opposition, passes unanimously of the members present. Ms. Gorlow will hand the bill right back to you. Okay, so with that, moving on to our next bill, which would be Assembly Bill 256.
Thank you, Madam Chair. Assembly Bill 256, as amended, requires a state plan for Medicaid to provide coverage of doula services to the extent authorized by federal law, and requires the Department of Health and Human Services to apply for a waiver or state plan amendment, receive federal funding coverage for the doula services. The Division of Healthcare Finance and Policy testified that there would be a savings resulting from this bill of $414,210 in fiscal year 2022 and $848,600 in fiscal year 2023 in their Medicaid account. However, the admin account would have expenditures of $58,000 related to their Medicaid Management Information System upgrades that they would need to do as a result of this bill. Mr. Young had testified that the savings that would be generated in budget account 3243 could be transferred to their admin budget in order to cover these expenditures. And again, this bill would also be required to have the back language provided for in the Appropriations Act in order to provide that transfer. Assemblywoman Summers Armstrong testified on this bill, and there were no individuals who testified in support, opposition, or neutral.
Thank you very much. Committee members, any questions or comments on Assembly Bill 256? Not seeing any, so with that, this is the first reprint, so this would be a due pass as amended. I have a motion from Ms. Benitez-Thompson, a second from Ms. Monroe Moreno. Any questions or comments on the motion? Dr. Titus?
Thank you, Madam Chair. I was a no on this when I first heard this bill, but I will tell you that I am going to support this bill and vote yes on it. Anything that improves healthcare outcomes and saves state Medicaid, which I'm convinced that this bill will do, I'm going to support. So thank you, Madam Chair.
Thank you, Dr. Titus. So with that, any other questions or comments on the motion? Hearing none, all those in favor, please signify by saying aye. Aye. Any in opposition? Hearing no opposition, passes unanimously of the members present. We will give the bill back to Ms. Summers Armstrong, but Ms. Monroe Moreno, would you be the backup in case there's a fiscal question that she can't, may not be familiar with? So always good to have a committee member do backup on that. So that is 256. Moving on, Ms. Kaufman, to the next bill, please.
Thank you, Madam Chair. The next bill is Assembly Bill 461. And that makes a $96,000 appropriation to the Office of the Attorney General for costs of replacing standard glass windows and doors with ballistic glass and frames at the Carson City office. Jessica Adair from the Attorney General's office testified on this bill, and there are no amendments recommended. Then there was no individuals who testified in support, opposition, or neutral.
Okay, thank you very much. So committee members, are there any questions on Assembly Bill 461? Not seeing any, the motion would be a due pass. I'll accept that from Ms. Benitez-Thompson, second from Ms. Monroe Moreno. Any questions or comments on the motion? Seeing none, all in favor, please signify by saying aye. Aye. Any opposed? Hearing none, passes unanimously of the members present. Mr. Watts, would you handle this bill on the floor, please? There you go. Moving on to 462.
Thank you, Madam Chair. The next bill, Assembly Bill 462, makes various appropriations to the Department of Corrections for upgrades to and integration of certain management systems for the replacement of cameras, storage areas, and networks, as well as ovens. The individual who testified on this bill was Lisa Lucas from the Nevada Department of Corrections, and there were no individuals who testified in support, opposition, or neutral for this bill.
Thank you very much. Committee members, are there any questions or comments? Dr. Titus?
I have a burning desire to go ahead and move this bill.
Okay. Do you need a hot pad to handle that
Yeah,
desire?
as long as it's not too hot for us. Thank you,
Okay.
Madam Chair.
I'll have to have some of those shipped back up here. There's still about 15,000 of them left when I messed up the order. Okay, so anyway, back on track. So committee members, are there any serious questions on AB 462 at this time? Not seeing any, the chair would accept a motion to do pass Assembly Bill 462 from Ms. Benitez-Thompson, a second from Dr. Titus. Any questions or comments on the motion? None of them being facetious, please. Hearing none because I'm not looking up. All those in favor, please signify by saying aye. Aye. Any in opposition? Hearing no opposition, passes unanimously of the members present. Who should we give this bill to? Oh, Mr. Watts, we're going to give this one to you too. Okay. And whatever happens on the floor, I will not be your backup. Thank you very much. There we go. All righty. Moving on to the next bill, 463. We got to get these folks out of here. I'm about to lose control of the committee. Here we go.
Thank you, Madam Chair. Assembly Bill 463 makes a supplemental appropriation of $2,962,213 to the State Department of Conservation Natural Resources for an unanticipated shortfall in the forest fire suppression budget account. I would note that Casey provided testimony on this bill and identified an amendment to the bill in the amount of, so the amount would actually be reduced to $2,359,168. And I would also note that there was discussion related to providing language in this bill related to a bill that was provided, Senate Bill 508 of the 2019 session, that provided funds of $5 million to the Interim Finance Committee for the support of these wildfire prevention restorations. However, that particular bill did not have reversionary language for that, and so the amendment would then provide for a reversion of June 30th, 2025 date for that particular funding source.
Okay, so with that, committee members, this would be, Ms. Kaufman, we would need to make this an amend and do pass so that we can amend in that particular language then, correct?
Madam Chair, that's correct.
Thank you very much. Just wanted to confirm that. So committee members, this would be an amend and do pass. Are there any questions from the committee at this time on this bill? Not seeing any. I'll accept a motion from Ms. Bedinas Thompson, a second from Ms. Monroe Moreno. All those in favor, please signify by saying aye. Aye. Any in opposition? Hearing no opposition, passes unanimously. The members present. Mr. Watts, third time's the charm. There we go. So with that, there's 2 bills left, but those are bills that we're going to be working on in the future. So committee, thank you very much for your hard work this evening. I think we got a lot done moving forward. So with that, the last thing on our agenda for this evening would be public comment, broadcast services. Do we have anyone in the queue for public comment before us this evening?
If you wish to make public comment, please press star 9 now to take your place in the queue. Caller with the last 3 digits, 196, please slowly state and spell your name for the record. You will have 2 minutes and may begin.
Good evening, Chairwoman Carlton and members of the committee. I know it's late. This is Eric Spratley, the Nevada Sheriffs and Chiefs Association. I sat with you for the last couple hours. And at the very last of the testimony from the NDOC on AB 358, my phone went blank. And so I don't know what happened. It's the world we're living in. But our membership supports AB 358. Our membership operates the county and local jails. The greatest hindrance to people being successful coming out of prison is us. It's the government. It's bureaucracy. Can we help these individuals be successful? Can we help them move from the pattern of incarceration to a new pattern of freedom? AB 358 is vitally important to the persons being released from incarceration so that they have the safety net of support available to them to close the door on recidivism. The door that happens to be the entrance to the county and local jails when people fall away from treatment. So having a continuity of care after incarceration is very beneficial to that person and our county and city jails. We appreciate Assemblywoman Nguyen stepping up to present this bill, the testimony by the professionals you heard. We actually appreciate the technology glitches because at least we've got technology to connect us. And we appreciate Speaker Frierson for bringing AB 358 forward. Please support that bill. Thank you, Madam Chair.
And thank you, and we'll be sure to take your support and put it in the appropriate place in the minutes. And we know what technology is like right now. So with that, broadcast services, do we have anyone for public comment?
Chair, the public comment line is open and working. However, we have no more callers at this time.
Thank you very much, broadcast services. You guys help us out every single day. So with that, committee members, our business for this evening is done. There's subcommittee meetings tomorrow. Not sure what the rest of the week looks like, but plan on being here a lot through the end of this week. So with that, we are adjourned.